Hi everybody. Okay, so today I'm here to talk with you about our home work and school setup. So many of us have been working from home for a while now, and some of you may continue to do that for the foreseeable future. So these are just some tips and recommendations that might help make your lives a little bit easier and to help reduce some of the neck, shoulder, upper back, and lower back tension that's been building from faulty positions. So the first thing that many of you can try if you're working off of a laptop would just be to use a wireless or a plug-in mouse so that you can use the mouse off to the side and keep your elbow at a little bit of a lower angle rather than using the trackpad on your laptop all day. The next thing that some of you can investigate in your home environment would be whether you have an external monitor, a desktop screen, or a second laptop, would be to try to mirror the other screen so that it stays at a little bit of a higher position so that that screen comes just below eye level when you're working. And that may mean propping it up on a milk crate or a box, a stool, something to bring it up to a higher position. And then you can work off of the laptop keyboard at a lower position, keeping your elbows at about a 90-degree of bend. For those of you that have sit-to-stand desks at home that work from home as your primary function, using that sit-to-stand transition desk to spend periods of time standing for about an hour and then sitting for about an hour so that you're frequently changing positions, which will help minimize the onset of stiffness. If you don't have a transition desk, setting up a card table and some stools, a couple boxes to bring your screen up to a higher position will be helpful. And then the other thing that many of you may be able to try would be to grab an exercise ball that you can sit on. This will help you engage the core muscle on both the front and on the back of your spine and will help you have greater ease of transitioning side to side, weight shifting forward and backwards, so that you're just minimizing stiffness and reinforcing that more normal position of your spine.